Good afternoon, everyone, and thank you for joining us. We have, I think, quite a few things to go over. We're going to focus today at the beginning on where we're at in the COVID-19 fight here in Minnesota. Comes at a time when the nation is seeing our highest number of infections. We're seeing some states close back down. We here in Minnesota are seeing another, what we hope is a plateau. We've been in this kind of pattern of down and then back up a little bit, but maintaining it. Still maintaining well in terms of hospitalization rates, positivity rates going up, which is never a good thing, but still hovering right around or below that 5% of positivity rate. Testing and the capacity is still maintaining itself for us to be able to get a pretty good sight picture on what's happening in Minnesota. And we're going to focus a little bit on the long-term care. Back, if you recall, in May, we had the capacity, our testing capacity had reached where we were hoping it would be, and a 5-point battle plan that we did collaboratively. And we've got folks here from Minnesota Department of Health, but more importantly, we have the folks who are in the long-term care facilities and who run them and who understand on a daily basis what these look like. And not all long-term care facilities are the same, whether they're skilled nursing, long-term care with more care and nursing staff on, or more independent living. And all of those factors play into the transmission of COVID-19. So we're certainly, we're going to talk a little bit today too about the end of the second special session with important work that was done and important work that was left undone, and what the next steps are going forward. So thank you all for joining us. Today I want to announce where we're at. We are not changed. We are still there. We have learned much. We're almost 4 months to the day since we announced the pandemic was coming to Minnesota. We needed to prepare for it, and we needed to build the capacity in our hospitals, in our testing, and change the way we did things to make sure that we could maintain over what could eventually be a year to 18 months before we advanced with therapeutics and a vaccine. So I think it's a good point at the 4-month mark to us to give a bit of an update around long-term care. You're going to, again, anytime we see any death due to COVID-19, and there has been some tragic developments over the last several days with a being infected today. And I think when it comes to long-term care, I'm going to make sure that we hear from Commissioner Malcolm. And as I said again, you're going to get the opportunity to hear from some of these providers. So we've made collective work, we've made progress, there's things that we've learned. I think going forward, there's things that we can continue to focus on, but the numbers are curving in the right direction, and we're going to have them there, because I think it is inevitable, again, until that vaccine comes onto the market and we have the requisite number of folks that are vaccinated, we're going to see this disease spread. And we are certainly not going to go down the route of states like Arizona and Florida, where we get in a situation. I was mentioning to Commissioner Malcolm, I have a friend that lives down near McAllen, Texas, in Hidalgo County, and it was just stunning to hear the numbers on that. Hidalgo County, Texas, just that one border down there by Brownsville, 1,000 cases of COVID in the hospital in one county, and the numbers, and about 34 deaths a day is what they're experiencing now. That's a county that less than a month ago had almost no infection rates. That's how quickly sure that the lessons we're learning and that we're focusing our attention do make a difference. So I hope today you get a chance to hear, especially from these providers, of what's happening in long-term care facilities. I say this is one that's obviously very personal to many of us. My mother worked in long-term care for an awful long time, and the challenges that go with maintaining that workforce, maintaining health, and preventing infections, whether it was pre-COVID-19 or COVID-19 now, is always a challenge. And these providers have been great partners in helping us do that. So certainly looking forward to that, and want to bring up Lieutenant Governor Flanagan to have a few words.
Thank you, Governor, and thank you so much, everyone, for being here. We know that older adults are an invaluable part of our community. They are our mentors, our volunteers, our parents, our grandparents, our friends, and our neighbors. And one of the most difficult aspects of the COVID-19 pandemic has been the impact on seniors, especially residents of long-term care facilities. I'm proud of the progress that we've made to keep long-term care residents safe and to slow the progress of the COVID-19 pandemic in these facilities. But I also want to acknowledge that these safety measures are hard. And it's really hard to be able to visit your loved ones through a screen or through a window. And that we certainly have heard about the impact on folks as they have been separated from their loved ones. I've shared many times, and you've heard this, that my mom and I are very, very close. And before the pandemic, my mom and I would see each other at least once a week. And my daughter would often have sleepovers at grandma's house. Now, while my mom isn't not in a long-term care facility, she does have underlying health conditions which put her at extreme risk. And so in order to keep my mom safe, we talk frequently on the phone, and I know she's probably watching this right now, so not as frequently as she would like, but also that we visit her from the balcony and are able to give her a wave, but that certainly does not compare with the hugs and kisses and just snuggles that my daughter enjoys with grandma. And so I know how difficult this has been for so many families. And to all Minnesota families who are missing their loved ones right now, I see you, and I am you. Social well-being is incredibly important, and I am excited about the creative ways that families are keeping in touch with loved ones. And this is really hard, but we'll get through it together. And I know that this has certainly been on people's hearts and minds. So as the governor said, this is not a victory lap. This is an update and a way for us to make sure that Minnesotans are informed about the good work that's happening. And with that, I'd like to introduce Commissioner Malcolm.
Thank you, Lieutenant Governor. Governor, thank you for being with us today. Good afternoon, Minnesota. Well, we are here to talk about progress that's been made in the long-term care field in response to the COVID-19 pandemic. As the governor said right from the beginning of this journey, this we knew would be a particularly important set of providers and residents and staff who have all kinds of unique circumstances that put them at higher risk of contracting COVID and of having very serious disease. But I'd like to start just by reinforcing the fact, and I think the governor made mention of this already, that the issues of in long-term care facilities are long-standing, and the focus of long-term care providers on health and safety of their residents and their staff long predates COVID, as do some of the staffing challenges and just the systemic issues that we know exist in this very challenging field. For us at the health department, we have been working for a really long time with long-term care providers to try to strengthen infection control and to every year when we have the flu season, many other kinds of infectious diseases pose some of these same challenges for long-term care. So our work on issues like this really very much predate the pandemic, but the pandemic put all of this into a very, very, very different context and a very different intensity and urgency. Over the past year, we being the Minnesota Department of Health, have provided assistance to more than 930 long-term care facilities on infection control measures, how to properly use masks and other personal protective equipment, and how to prevent and respond to a potential outbreak. This spring, MDH staff have conducted infection control and technical assistance on-site visits with 245 of the Federal Centers for Medicare and Medicaid this spring with a special focus. As the governor said, stepped up the support that we had historically been doing in this sector by rolling out and staff. And I want to thank the governor for setting out some very ambitious goals and for really pushing us to step up our game. Since that announcement, we have been standing up the long-term care plan and in really, I think, harvesting some very, very hard-won lessons by some of the first facilities to encounter problems with managing COVID-19 outbreaks specifically in these very important facilities. Thanks to the very hard work of so many people at our department, the Minnesota Department of Health, our local public health partners, and of course, the exceptionally hard work of the long-term care providers themselves and their staff, we can report today that the clear majority of nursing homes and assisted living facilities in Minnesota have no current identified COVID cases. These facilities are safer today than they were at the beginning of the pandemic. And the proactive measures we have implemented in partnership with them have thankfully made outbreaks the exception rather than the norm. Here's some of the recent data. Half of Minnesota's 368 skilled nursing facilities or nursing homes have not had a reported case. About 1/4 of Minnesota's nursing homes currently do have an active outbreak, but remembering that we define an outbreak as one case. And the whole goal is to work closely with these facilities to prevent that one or two or several cases from becoming a major outbreak. Over 3/4 of Minnesota's 1,692, and less than 10% of assisted living facilities currently have an active outbreak. The growth in the number of new facilities reporting outbreaks each week each day, has slowed significantly. In early May, we were reporting on average 23 new facilities every day reporting an outbreak. By mid-July, that number is down to an average of 6 new facilities reporting new cases each day. We've also seen, gratefully, sharp declines in the number of deaths among long-term care residents from the peak. Even one preventable death from COVID is too many, but the downward trend we've seen is very encouraging. In the 3rd week of May, we saw 137 deaths among long-term care residents in that week. Last week, we saw 13 deaths among long-term care residents. So that's perhaps the most graphic measure that we have on the impact of this work, how very important prevention and control and active infection control is. So I'd like to just give you, but before I go there, I just would like to make one further point to amplify something the governor said and the lieutenant governor. We're really proud and impressed at the progress that's been made with all this hard work. And we know that even though the majority of facilities have not and do not have cases currently, we think it's vitally important, as the governor said, COVID is with us, it's going to be with us. As we see community spread, it is frankly inevitable that there will be more cases in long-term care. So our message and our partnership with the long-term care provider ability that most will be needing to deal with cases of COVID-19 over the course of this pandemic. So let me give you just a few examples of the progress we've made on the specific 5 goals that the governor set out back in May. The first goal was to expand testing as such a key to know what's going on and to be able to get on it right away when we find those first cases. So that first goal was to really significantly ramp up testing. So we developed new testing criteria to say that all facilities with even one confirmed case or 2 people with symptoms should do facility-wide testing. And that was a big change from the testing guidance earlier in the pandemic that really looked to only test symptomatic people. So that was a major shift in the strategy to do more widespread testing in long-term care. So we also not only put out that guidance about the need to expand testing, but built a lot of capacity to help facilities be able to get that done. The ability to support long-term care facilities in doing that kind of testing has been so greatly supported by an extraordinary partnership with the Minnesota National Guard, as well as collaboration with health systems, physician groups, and other private entities. And through the state's testing partnership with our state's health systems, Mayo, and the University of Minnesota, we were able to get additional testing access for these long-term care facilities. Thanks to this partnership, as you've heard from us before, we now have the capability to conduct 20,000 tests a day. And we've recently developed a process to transition away from our reliance on using the Minnesota National Guard for testing, as the governor has been eager to get the Guard back to other aspects of their critical missions. So we have now developed a plan over time to be able to transition the work that the Guard has been doing into sustainable efforts going forward by leveraging additional partnerships with healthcare providers. The second part of the plan was to, again, related to testing, to clear out some of the barriers that would have made that sustainable going forward strategy difficult. So the first part of the plan was get the testing done, get it done now, get the National Guard in to help. The second part of the plan was build a system that can sustain over time. And we've done a lot of work to streamline the process to help long-term care facilities prepare for testing and execute the testing. We've worked to develop processes for facilities to request testing support and to have access to a range of resources and materials. Many facilities, particularly in assisted living, do not have an on-site medical director, so we've made access to an ordering physician for the purpose of testing available through the State Health Department, which allows facilities to order tests and further streamline the process. Thanks again to that testing partnership with Mayo and the University of Minnesota, we've been able to develop a streamlined billing process and guidance for tests that get processed through the state's testing work group and are in the process of doing the same for COVID tests processed by the private sector, other systems. We've also implemented a nurse triage line in the last few weeks to provide test results and information on COVID symptoms to support the follow-up to testing. And we've contracted with an increasing number of community resources to assist, as I mentioned, with the sample collection process as the Guard begins to transition out. The third goal of the long-term care plan was to get personal protective equipment to facilities when needed. That was one of the real challenges early in this pandemic and what really, frankly, kind of set the facilities up to have a challenge. They have never been prioritized for the kind of personal protective equipment that is much more common in acute care settings. So it was many of them who were confronting the first cases really did not have access to the personal protective equipment that is so very important for infection control. So that's been a major effort to get a better sense of what they need, where they have supplies, where they don't, and how to use some of the state's assets that we've built up on personal protective equipment to get them out to the providers when needed. So starting in April and continuing each month, we've been pushing out waves of personal protective equipment to long-term care facilities. And to give you a sense for the size of that effort, looking at the nursing homes, the skilled nursing facilities, between June 15th and 23rd, so that was our push time for skilled nursing facilities. There were 358 skilled nursing facilities to whom we pushed out almost 11,000 gowns, over 716,000 gloves, over 28,000 face shields, and 57,000 N95s. Then, between June 30th and July 2nd, we provided about an additional 50,000 N95 masks to 200 nursing homes. We've also worked to expand access to the assisted living facilities also to personal protective equipment. Since July 4th to the present, we've provided to 2,129 other congregate care facilities over almost 213,000 gowns, 2.8 million gloves, 173,000 face shield, and 475,000 face masks. So a fair amount of the state's procurement of personal protective equipment has been made available to this sector, which is a big change from kind of the scheme of the past, which was very, very focused on acute care only. The fourth part of the plan was ensuring that there would be adequate staffing levels for even the hardest hit facilities challenged with larger outbreaks. We developed a scheduling software system that enables facilities to report concerns and us to monitor and identify growing staffing shortages, and to be able to quickly connect the facilities with staffing needs to available qualified staff. We've implemented a crisis staffing team to provide technical assistance to facilities, identifying at-risk facilities through a ranking and prioritization process where we use a number of indicators to highlight when a facility is likely to be in need of additional staffing. So again, not just waiting till the crisis appears, but really trying to get out ahead of it and work upstream to see when a problem might be coming. And again, through this software system, facilities are able to request support with filling certain shifts where they know they're going to be short. Interestingly, and in the true spirit of One Minnesota, more than 1,100 qualified healthcare professionals have signed up to be volunteers in that database to support staffing needs in long-term care when needed. The fifth and final point in the long-term care plan has been to leverage our partnerships to better use their skills and talents so that this would not all be a St. Paul, Minnesota Department of Health centric response, but really increasingly based in community resources like our partners in local public health. We knew we'd be more likely to succeed in reaching the governor's ambitious goals and to build a sustainable strategy for the long term if we could leverage partnerships not only with local public health, but with the long-term care provider system, the associations, and the regional healthcare preparedness coalitions that you've heard us talk about, again, in the context of hospital preparedness, but getting those regional healthcare coalitions also involved in supporting long-term care in their regions. And we've done that, working with local public health, hospitals, healthcare systems, emergency medical services, emergency managers, all now involved in this effort to execute the testing priorities, to help with emergency staffing, to help with PPE distribution, patient surge capacity, and through the development of training, education, guidance, and policies. It's been a lot of work, but it's not just items to check off on the to-do list. It is done because it produces results, and it has produced encouraging results in helping facilities to prevent and manage outbreaks, to keep outbreaks at small levels, and very importantly, to save lives. When facilities implement best practices, when PPE and testing are available, we can protect residents better and turn the tide on the disproportionate toll of this virus on some of our most vulnerable. But as we've all said, we recognize that we have much more work ahead. We can always further improve, and we know there will be more challenges from COVID as it continues to unfold in our state. But the good news is that the structure, the processes, the relationships that we've built up in these last months, and it is amazing to think that it's been 4 months and really 2 months since we've been working intensively on this long-term care plan that really has positioned us to meet these challenges going forward in a far better prepared state than we were at the beginning of the pandemic. And with that, I'd like to introduce one of the folks at MDH who's leading this charge, Michelle Larson, our Director of the Health Regulatory Division at the State Health Department.
Good afternoon. I'm Michelle Larson. I'm the Director of the Health Regulation Division at the State Health Department. I oversee long-term care as well as many other parts of healthcare in Minnesota that we regulate. So thank you, Commissioner Malcolm. I just want to point out 3 things today before I turn it over to some of my colleagues that we work with in the Health Regulation Division. There's been a lot of work into the progress that we're reporting today, and as my previous colleagues have mentioned, this is not to declare a win today. We still have a lot of work to do, but it's a moment to pause and maybe give you all a look inside of the type of work with our partners that we do. A lot of that work is not only just from the Health Regulation Division. You've heard from my colleague Chris Erzman in infectious disease. We work very closely with our infectious disease partners. And I just want to thank everyone at the Department of Health, as well as the Governor's Office and the rest of our colleagues statewide for all the work that it takes to work on long-term care and prevent COVID in our facilities. And this is more than just work of government, more than just the work of the state agency. We've had a lot of great cooperation and partnerships from other parts of state government, many of the other state agencies, including the testing work group in particular that we work with, that Mayo and the University of Minnesota are part of the work that we do with testing, so we want to thank those partners as well. And I want to acknowledge all of the work of the state and local government. We work very closely with local public health in the communities. We have regions around the state of Minnesota that work with our healthcare systems. If we did not have the cooperation and the partnership with them, we would not be as further along as we are with COVID. But most of all,
I definitely want to thank our long-term care partners, the staff, the residents, the administrators of those facilities. It's so important, the work that they do, to help support the work that we do with them in order to prevent COVID, both looking back and looking ahead. We all thank them for their hard work and their dedication for getting this right. That is a very hard industry to work in, and they have really gone above and beyond to fight this pandemic with their residents in those facilities. The last thing I want to mention, and you hear others saying this, is we still have a lot of work to do. This is not over. There's still a lot going on in this country, a lot of the rates that are going up. We cannot declare victory on this pandemic yet. And as much as we would like to move on and do that, we have to still work really hard every day. We're optimistic that the work that we've done to this point means we're better positioned to face those challenges. We've had a lot of learned lessons in the last few months, as the commissioner has mentioned, all the work that we've done, but we still have a lot of work and a lot of lessons learned to go, and we understand that. I'm optimistic as a leader in public health over long-term care that we can do this. We can continue to partner with our facilities and with all of our government partners to face those challenges and really limit the number of illness and death and spread of COVID in these facilities. With that, I want to turn it over. We have some time today. I'm really proud that we have facilities here today, their administrators, to talk to you about their experiences that they've had with this. So we'll start with Annette Greeley from Jones Harrison Residence.
Thank you, Michelle. Thank you, everyone, for having me here. My name is Annette Greeley, and I'm the president and CEO of Jones Harrison Residence, which is a nursing home and assisted living campus in Minneapolis. And today, I just want to express how Governor Walz's 5-point plan helped enhance testing in long-term care settings, and we are thankful for the support that we received from the state of Minnesota. Testing our residents and staff in partnership with the National Guard was a game changer in our ability to contain the spread of COVID-19 and take the necessary measures to ensure the safety, health, and wellness of our residents and staff. We appreciate the collaborative partnership with the Minnesota Department of Health and know through this plan, we are better prepared in our ongoing efforts to combat COVID-19. So we're very thankful to be here to be able to let people know what a positive effect it has been to work with the Department of Health, with the commissioner, with the governor, and that this fight is not over and we will keep fighting. Next is Michelle with the facility in Brainerd.
Thank you, Annette. Good afternoon. My name is Michelle Sowald, and I am the administrator at Good Samaritan Society in Brainerd, Bethany campus. I just want to thank you for allowing us to come here today to tell our story. We are forever grateful for our employees, our rural community, including our hospitals, and the state of Minnesota for rallying around our location when we experienced an outbreak. It was always about collaboration and the well-being of our residents. The Minnesota Department of Health was a key player for our success by sending us 9 FEMA nurses during our emergency crisis staffing. Collaboration is how we got through the hard days, and that's what long-term care facilities across the state will continue to need as we move forward through this pandemic and fighting this invisible virus that spreads like wildfire. The team support and the Minnesota Department of Health and the governor means so much to us. Thank you. I'm going to turn it back over to the governor.
Well, thank you again, Commissioner Malcolm. As you see, this is a partnership. We have, as you saw, about over 2,000 between skilled nursing, long-term care facilities, assisted care, of where our seniors are at and where those that need the extra help. And with COVID-19 predominantly hitting older populations, predominantly hitting those with underlying health conditions, this became a very big challenge. And I do want to thank the facilities for their willingness and their desire to make sure that we were using best practices and moving forward. So thank you all, and be glad to take any questions you have.
Well, the number of tests or the number of cases might be down, the number of deaths is still stubbornly high. I think it's at 77% of overall deaths still. It was 80% when you started the battle plan. Do you wish you had started this sooner?
I wish that we as a nation had started in December. Yes, I wish we as a state would have started sooner. The thing I will say about the percentage thing I would say about this is be very clear about this. The number of deaths that are going to be in long-term care facilities in the elderly is always going to range anywhere, I would assume, from 65 to 100% on COVID. The issue here is that those numbers back when we started this were about 30 deaths a day. Now they're down to 1 or 2. So as a percentage of the overall state's population, it's always going to be heavily towards that. It's just the nature of it. I think that the key here is controlling infections. And this is a real challenge. I think some people here, the health reporters know this. One of the leading causes of death in the United States every year is hospital-acquired infections. About 90,000 people die every year going into a hospital for something unrelated and they get an infection. Long-term care facilities are very challenging on this. And as you heard the commissioner say, we going up into this pandemic, we're not even providing PPE. We were not viewing it that way, and we were leaving a lot of those. So yes, I think in lessons learned on this, once we understood what COVID was doing, but it was hard to tell back in March or April exactly where this was going to fall and where the resources had to go. So as we were ramping up hospitals, it became apparent that we needed to make sure that long-term care was covered. Anything else on this issue?
We'll take some questions on other issues.
We'll see if there's any more on this issue, and then we can go to some others. Yes?
I do have a question. I'm curious what factor played the biggest role in kind of getting deaths down, and why maybe Minnesota had a higher death rate at a certain point in long-term care versus other states.
Well, first of all, I'm going to let Jan discuss that. First of all, there's a bit of a myth around where Minnesota is as a higher number, because as we've seen in this as data, apples to oranges in a lot of cases. We have been very clearly on of reporting very widespread of those 2,000. Many states, if I'm not mistaken, Jan, are reporting only skilled nursing, where you have much more intensive care, you have much more nursing on being in place. And I think for us, certainly one is too many. And the one thing that we saw is we have a large number. Some of you remember this too. It was not until last year, Minnesota was the last state to come on with some of the regulations over long-term care. We did not have that in place. That has not been fully implemented yet. So I think there was a recognition in Minnesota a year and a half, 2 years ago, that we needed to move to working with our partners who have been asking for some of this to finally implement. Holes in our system be pretty glaring. But I think, and I'll let Jan or if anyone wants to speak, I think it's that infection control and that focus. And the thing that I've been saying the whole time is knowing what we were dealing with and that testing is a key issue. And I don't know, I saw this. Again, the White House is announcing they're going to get testing to all of our long-term care facilities. Here's the thing. They told us that 3 months ago. That is not going to happen. We talked to Cephia, the company that does it. Most rural areas are covered by the Cephia system of testing. There is no plan to make that happen, so the state has to do that. That's why this push on testing was so big, so that we could step in, we could have a site picture on what was happening, we could use the best practices on isolation, and we could stop that spread. And I think Jan's numbers are pretty impressive, the number of facilities that did not get this, and then when facilities did get it, the way they manage that care. So Jan, if you want to add.
I think the governor hit the key points. And to Tom's point about percentage-wise, it's true that we've made modest gains on the percentage. Minnesota's mortality rates overall and in other age ranges are really quite low compared to national standards. So I think it's a combination of really low mortality rates in younger populations in Minnesota. I think in terms of what we're doing better today than we were, and again would stress infection control and personal protective equipment and better control over things like cohorting positive residents. Really, the facilities have done a good job of stopping some of the congregating activities that were still going on earlier in the pandemic. Folks were still eating together and socializing, and certainly as the Lieutenant Governor indicated, those social aspects of life are a big loss. But changing some of those things, restricting visitation, being much more careful with staff coming and going from the facilities have all been things that have really changed the trajectory here.
To that, nationally, they were still saying that Minnesota had, if not the highest, one of the highest long-term care death rates in the country. But you have said in the past, and I'm hoping you can explain it again, why we report a little bit differently, or maybe report more broadly in what is included in long-term care. Is that accurate?
Yeah, thank you, Tom. Yes, when you look at the data strictly from skilled nursing facilities, which is the more apples to apples data, our cases per population, per 10,000 population, are in about the middle of the pack, and our death rate is actually much less than half the national average on a per population basis, just for skilled nursing facilities. So that's the apples to apples part. Long-term care is not a defined term. A lot of people assume nursing home or assisted living when you talk about long-term care. Here in Minnesota, we've been reporting things like group homes, adult foster care, memory care, substance abuse units, all things that share that characteristic of congregate living and populations with some degree of underlying health vulnerability. So from a public health control standpoint, all of those facilities are really, high-risk facilities. So we've been including in our, we've called it congregate care. We've been reporting that all-in number because of the very legitimate questions and the desire to be more comparable to other states. We've started breaking out the skilled nursing facility and the assisted living facility data more clearly so that you can see the subset. And again, just refer you back to the Centers for Medicare and Medicaid Services, which has the national data on skilled nursing facilities only, and we're in the middle of the pack on cases and below half of the national rate of deaths per population.
You talked about the lessons learned. I can't help wondering, though, those lessons could have been learned looking at Washington State and the original cases that happened there. I'm just wondering why, when it's things like masks and personal protection equipment, things you were already working on in infection control, you knew those were problems then. Why didn't you take heed at the time before we started to see deaths and then need to react in a hustle?
Yeah, I appreciate the challenge, Jeremy, but I think remembering where we were on personal protective equipment in March and April, we had been assuming that the Strategic National Stockpile was going to be the answer on those questions. And it wasn't really until well into April that the federal government essentially told us what you've gotten. We got a very small pro rata allocation from the Strategic National Stockpile, and to our surprise and deep dismay, we were told, and that's it. You won't be getting any more. So we had to really ramp up the procurement of state supplies, which we'd never had before. We have never had a state stockpile of personal protective equipment until under the governor's direction and the leadership of Commissioner Roberts Davis, that we've built up a system for tracking what the supply needs are and for sourcing all over the world. So again, it's hard. It seems like we've been doing this for ever practically, but where we were in the early days of the pandemic compared to where we are now is really quite a stark change. And some of it was sort of the bias, especially in the kind of the Strategic National Stockpile approach to things that said only hospitals are eligible to get this stuff. That we really built up both a new philosophy to say, no, we really need to care about the entire continuum of care, not just hospitals and acute care clinics. But then it was just building the supply itself. That took a while.
And I'll take that too. Jan's a professional civil servant. I'll take this because there was no national strategy. 50 governors are getting this same question all the time. This is what's so frustrating about this, and I have to tell you again, here's what was really frustrating. We are right back there again. 3M cannot keep up. We're hearing about PPE shortages across the country. We're seeing testing being diverted and testing essentials being diverted away from states like Minnesota, who once they said they weren't going to do it, and once it became apparent that we could not count on them, we built our own, and now they start to undermine that from the backside. So this is, yes, I think as a nation, we need to do some real soul searching once we figured this out, and we did learn lessons relatively quickly, 30 days into this, and then started to. By that point in time, we were in that free-for-all of the marketplace where PPE was being diverted from across the country. Planes were landing. You had the governor of Maryland, because his wife has connections and is Korean, going to Korea, getting a plane and flying it back. Same thing in Chicago. I mean, those were the type of situations that led to where we're at. The frustrating part is, here we sat on July 21st, no Defense Production Act, shortage of reagents in some of the major testing for lab testing, and shortage in PPE at a time when we're talking about going back to school and expanding our opening without that part being done. So it's a totally fair question, but I think the key here was we can blame the 50 governors or the 50 health who are all experiencing the exact same thing, or we can decide, why don't we go back and have a strategic national discussion about how do you deal with a pandemic, just exactly like every other administration did. So I'm worried, again, I have to be candid with you, that we have got ourselves in a good position. I think we're laying this kind of a level set here, that there's work to be done, but it could get very tight again, and putting those workers back into those facilities without personal protective equipment is the surest way. This is the way it was coming with workers. It was coming with workers into facilities and being transmitted. That's what we started to learn that started to turn that number down. So, anyone else on this topic, or are you ready to move to another one?
Wondered if one of the care providers could discuss this. Perhaps, Michelle, you discussed a crisis situation of a shortage of workers. I just wondered if you could provide a little more of that story. What created the crisis? Why did you need 9 people?
Absolutely, I can expand on that a little bit more. So we had a resident test positive, and with the collaboration with our local hospital and our medical director, we did a mass testing of all of our staff and all of our residents. We started getting the results back within a few hours because they did rapid testing. And the first mass testing we did, we had 13 residents test positive and 9 staff members. And within the next couple of days, we still had residents and staff start showing signs and symptoms. So we were doing individual tests with those signs and symptoms. We decided to do another mass testing of all residents and staff, and we ended up having 11 more staff members and 10 more residents. Overall, we had 32 residents and 29 staff members. We have a building, we are running at a capacity of about 85 beds. So if you can think about that, with 29 staff members out, we were truly in emergency crisis staffing. We had no staff. We were calling our national campus. They were trying to get pool staff in for us. They were about 2 weeks out. So then the Department of Health actually stepped in, and they called up FEMA for us. FEMA was only supposed to stay for about 5 to 7 days, and after our second mass testing, we still had more residents and more staff with symptoms and still going out. So they ended up staying for 14 days with us. And we actually had a separate COVID unit just for all those 32 residents. So our regular staff, the ones that were left, were fighting the fight in our regular long-term units. And then the FEMA nurses, along with our staff members, were fighting the fight in the COVID unit. And I just want to make this a little bit clear too. The regular staffing ratios on a long-term unit are about 1 nurse to 15 residents. In our COVID unit, we were running about 1 nurse to 2 to 3 residents. We were running truly an ICU in our long-term care unit. And it was because of those FEMA nurses that we survived, that we didn't sink. They had the expertise, and they came in and could step right in and help us. So we are forever grateful for them, and I would do anything to show my gratitude. Any more questions?
I think that description is really kind of where we're at on this, and it does tie in a lot of that. This idea that there was something that these facilities did wrong in the early part of COVID is simply not the case. It was very challenging. And then the thing that we found very quickly is once it spread through the residents and the staff, this staffing issue became absolutely critical. What do you do then? What happens if people can't come to work? These are folks in their 80s and 90s who needed this skilled care or who need that help, and they weren't there. That's why this became a real challenge, and it was replicated across the country. Let's, if you want to stay on COVID or you want to go somewhere else? All right, let's do a different one.
On bonding, Governor, there was no bonding deal last night. Speaker Wortman and Leader Gazelka kind of were pretty pessimistic this morning about chances of getting that done if the legislature comes back in August. What's your reaction? Do you think they can get there, and how are you going to get them there?
Well, I am disappointed. It's 3 years in a row that we haven't done the most basic thing that a state should do, is maintain its basic infrastructure. It is the most fiscally conservative move that you can make, and it's one that is supported almost universally by mayors, city councils, county commissioners, and the general public. With that being said, I think it's incredibly unfortunate that the idea that we can't lift the highway in Henderson so it doesn't flood every year, because I'm ordering masks for long-term care facilities. That's part of dealing with the pandemic. I need to do that. The legislature would take about 90 days in what we can do in about 48 hours. That was why the framers of our Minnesota Constitution and those that put in Chapter 12 made that clear. So we've gotten the pandemic confused with the bonding bill. I feel frustrated for the trades. These jobs that need to be out there, especially at a time of economic downturn, are waiting to be done. There is a lot of excitement. I started with the Lieutenant Governor way back in November of touring and seeing this. Now I've got National Guard facilities built in the 1950s with leaky roofs of troops that are getting trained to go overseas and protect us, and we can't fix the roof. It's unfortunate. And now we're in a bit of a jam that because of the sales of bonds and the regulations around that, as Commissioner Franz says, we kind of go into a quiet period where we can't do anything. So if we were to try and do a bonding bill in the middle of those sales, we would have to stop all existing projects that we have going. And the way bonding works is you load the pipeline years in advance. So the projects we have going now, we're back. But now, every year, just can't get a bonding bill, just can't get a bonding bill. And I think we need to be very clear. Leader Doubt has made it an issue that he does not want to pass a bonding bill. Senator Gazelka negotiated in good faith. Senator Senjum and his members negotiated in good faith. Speaker Hortman, who is always there trying to get a deal, and Mary Murphy did that. Our administration was there every step of the way. We know that the need was about $2.6 billion. We were willing to settle for 1.3 to go to half if that's what it needed, because that was the start. And yet this idea that what 49 other governors are doing, this idea, and I will put it out to you, the compromises that I was willing to make, something as simple as this. I said, if you really want to help us on the COVID thing and you really don't want me to have to do these executive orders, then why don't you guys author a mask mandate, which we know that 26 states, many Republicans, most businesses, even the president says is a patriotic thing to do. No, just can't have you doing any of those things. So yeah, my frustration is very high. I don't, to be honest with you, in life to try and bring people together, and I hope we talk about it. I'm proud of the work we were able to do around police reform, get some things done. But I think in a democracy and where it's required to get the 60 votes, it has been clear now for 3 years that Representative Doubt does not want a bonding bill, does not want the jobs in Minnesota, and has found a different reason each year for that. It just keeps moving. I don't remember what it was last year. It wasn't a bonding year. It wasn't a bonding year. We didn't do it last year. And the year before it was, I don't remember what that one was. And this year it was the pandemic would do it. So
Is it the chances dead, no bonding bill this year?
Can't do it in August, I don't think. So now we're pushed back. We lose that opportunity. I'm not going to stop the projects that are being built. It's irresponsible. I will say this, that Commissioner Franz was just talking about this. We did something that very few states are going to be able to do. We maintained a AAA bond rating. One of the things they want to see your state doing is you can't get a good home loan if you let the roof fall in. And so these bonding agencies who make the low rates want to see that your state is keeping up your buildings, keeping up your roads, keeping up your bridges, all of those things. And the Lieutenant Governor is right on this, expressing absolute dismay that housing infrastructure bonds wouldn't go, that are massively needed, that absolutely are a cost benefit, and we didn't get those. So I guess we'll reassess on this, but the thing that I hope understands in this, from the building trades to the mayors to the businesses, not getting the bonding bill done was simply unacceptable. And just to be very clear, massive compromises made across every sector, every caucus, except for the minority caucus in the House, the unwillingness to bend.
August?
Because, and I will be careful on this and qualify it, Tom, and I will have Myron Franz come back to you. We're selling bonds in August. When you're selling bonds, it's much like if you're going to get a home loan. You know how you can't take out another loan and you can't use your credit cards and you can't do things like that? Because what they're afraid of is you're shifting money in a shell game to show that you're more fiscally responsible than you actually are. So what states have to do is when you get ready to sell bonds, everything settles into the place that it's at. So if we spent, which we would be spending, investing in the bonding bill, that would distort where we were at, and it would make that bond sale not be able to work. And we told them that, we explained that to them. It was absolutely clear to Republicans in the Senate, Democrats in the Senate, Democrats in the House. Apparently was not clear to the Republicans, and they said, well, we can just do it in August. It's untrue, we cannot.
Follow up back on COVID. Any update on the mask mandate that you get asked about all the time? And then the schools, I know you're going to announce this in a week, but people are wondering.
Yeah, the week of the 27th, absolutely. And the mask, and again, I want to say this, thank goodness, the president yesterday when he tweeted wearing masks is a patriotic thing to do. To the businesses and to the mayors across the state, I want to say thank you for doing this. I made no bones about this. Getting people to buy in to wearing the mask is what you're trying to do. The mandate is not to punish people, it's to put the emphasis behind doing that. And what I've said is if the president wears a mask, you will instantly see 10% of the public or more go up and do this. We know by the research that a mask mandate adds about 25% to this. When we have a mask mandate in a state that is controlled by one party and they do it, it goes up even more. Like all did a mask mandate. The most Republican state in the nation did it, and they saw their numbers go up. So what I've been trying to do is just asking Republican legislatures, why don't we jump off this cliff together? Why don't we do that? They're not willing to do it, and that's one of the reasons why Chapter 12 is there. I think you can expect an announcement, Tom, in the next day or two.
Need one with the biggest cities already having done it and most large businesses? Do you need a
The
mandate?
businesses tell us we do, and one of the things is that they think there's a clarification on it in that they don't want to have to battle people coming in. It just makes it clear across the board. And I think what we see, and we've talked about this, I think there's an argument to be made around regionalism. But the one thing, and Jan will tell me this, is when we get into the regionalism thing, we see it across the country, you tend to get a bleed over because, okay, so you don't have one in St. Louis County. Well, everybody goes to St. Louis County from other places. So I would like to, here's what I would wish, Tom, is I think in answer to your question, the simplest thing we can do to get back in school, the simplest thing we can do to open up and make sure our businesses remain open like they are, and the simplest thing that Republicans can do to make sure that I don't have to take executive actions around the pandemic is to wear a mask. So my hope would be here is if you really want to say, we want to get back to business and we want the governor to stop doing these things, wear the mask. You could really show me. You could show me that we don't need to do these things, and that's what I've asked them. So I wished we didn't, but I think we've seen in other states, and listening to Republican governors say it, they finally got to that point. I heard, I think it was Governor Ivey yesterday on the governor's call said, I believe in personal responsibility, but sometimes you have to help people be responsible. And so that is the most Republican thing I think you could say around a mandate possible, and probably true. So, Peter?
The former speaker, Representative Dowd, said that you and he had some conversations about powers. Some negotiations that he thought were fruitful. Can you share what you may have offered as far
Yes,
as...
I'll get it to you. It's actually 11 meetings. 5 of my offers and 5 of my attempts to meet were met with silence. So this thing about going out there and saying, oh, you know, the governor didn't do this, I have learned my lesson. I have got a timeline and I'm bringing the receipts on what I asked. And I was willing to do things that no governor in the nation was willing to give up on. to try and get this working. But I am not going to turn over the responsibility of things that need to move quickly. And again, it's not even turning them over or giving away. It's just the mechanisms don't work fast enough. And to be very honest, if there would have been a real show of faith of a frustration with executive power, I don't hear a single word when the president uses executive powers. I don't use a single word when we get false information around COVID. And if you continue to tell me the emergency is over and COVID is not that big of a deal, the people of Minnesota should be very skeptical about trusting in that. But I went, and we'll show you, I believe there was 11 different meetings, some of them very extensive, with my legal counsel, with things that we were willing to talk about and to move. And the one thing was, I have to be candid, I was not willing to give up and say that the minority members of the House of Representatives had veto power over everything I did. That is not the way our government works. That is not the way the votes work when they voted for Lieutenant Governor myself to sit in the executive branch. Now, I sympathize with them and I empathize with them, and I'm actually a kindred spirit on this idea of balances of power, but there comes a time when decisions need to be moved quickly. And I continue to ask, which things do you disagree with? Which of these things do you disagree with that we shouldn't have? And there are a few of them, but many times they're the very things that are actually making a difference. So.
On the police bill, top lawmakers and you have praised it, but there's plenty of community groups who say it doesn't go nearly far enough.
Yeah.
Just as an example, on the warrior training, it prevents taxpayers' money from reimbursing officers who get the warrior training, but it doesn't prevent the union, for example, from offering warrior training.
No,
what
that's
do you say
right.
to the people who say it doesn't go far enough?
Well, I think in many things it's towards that more perfect union. No, if I had put this forward, it wouldn't have looked exactly like this, but that's not the way it worked. I think this was a tough one. I think we in this room need to recognize as the epicenter of a global movement on re-looking at what community safety looks like. The desire to get something done was great. There are big moves in here. There are generational moves. Are there things left? Yes, I'll have to tell you, the first text I got came shortly after midnight from family members who expressed their deep disappointment that it didn't go far enough. They want to know what's that do about their loved one. They were talking about qualified immunity. They were talking about the statute of limitations, things that couldn't get there. So what I would say and what I would respond to people is that no piece of legislation is perfect, and I wouldn't view any as the end. As our society changed and as this issue became apparent, we were able to move. I think it's pretty amazing. You think about this. We moved some of these issues around post board, around chokeholds, around warrior training, and granted, maybe could have gone farther. We were able to pass that, and there was not a single hearing on this in the Senate. And yet they still voted for it and passed it. I would consider that to be progress, and that's because the public's asking for it. So my I guess word to you is, and Lieutenant Governor, we talked about this a lot, the emotion of being glad to see us come together and move significant reform, but also the sense of frustration and in many cases anguish among some of these families that they didn't get what they wanted to see in this bill. And I think that's why it behooves us to continue to work together. The one thing I would say that's real positive about this, not just being bipartisan, families, activists, and police representation were involved in this. They sat at the table. I think at a time when everybody wants to put us in separate camps and everybody wants to have you come down on one side or the other, this piece of legislation was crafted with everybody at the table. And so it's a good start. It's one that I think Minnesotans needed to. I'm glad they came back to do it. Once again, only divided legislature. Once again, a legislature that was willing to walk away from the best economic thing that we could do in passing a bonding bill that probably has 90% support in the country, certainly has a majority of votes in the House and in the Senate, had our support and our compromise, and we didn't get that done. I think it is nothing short of a good thing that we did move the police reform.
One more bill, and then back here.
Can I get one more?
Yeah.
Sure. Sorry, I was just wanted to get a little more from schools on you. With case counts of COVID rising in your state, with what's happening across the country with rising case counts. Does that weaken your resolve to get the kids back in the classrooms at all? Are you
No, it doesn't weaken my resolve, and as I've said this, I don't like to speak in hyperbole too often, and I don't think this is. I think I'm safe to say that nobody wants kids back in school more than me, both as governor, as teacher, and as parent. That is the best place for them to be. Relationships matter. It's not the best place to be out for most of these kids, and we have to figure that out. We have been working nonstop for months to figure out how to best do this and make it safe. And I think, again, we have to look at our individual situation. This is one of those cases where the data is continuing to grow. Again, every time I see in this infant death that was so tragic this week, you start to see these things. It doesn't weaken my resolve, but I have a responsibility to, as the science evolves, to evolve with it. And what I would tell Minnesotans is we're doing everything possible to get those kids back in that classroom, get them back there safely. And the key that I'm telling my team is to be able to keep them there, but to have a nimbleness that if we see these numbers climb, to be able to move a little bit the other direction and to not disrupt the learning. Because once again, I think about this, all that spraying, all that cleaning, all the things that need to be done, that's going to be really important. But it's the joy and the spark of learning that happens in there, that happens when people are in that same room. We have to make sure that that's still able to be there. And this is going to be a challenge. This is another one of those, much like masks, it's absolutely insane that the decision to get back in schools would be viewed as a political move. And I will just candidly say it personally, and I don't take much personally in this job, but I do take it personally around schools and around teaching and about something that I feel like I know. And the idea that I would not want kids in that room and be there safely, that is not the rhetoric that's going to get us there, help us out. And the one thing I can tell you is we went home without a bonding bill and without a supplemental budget. That makes it harder to get things in schools because this is going to take a lot. I ask people, the one I saw the story, and I would ask this question, I saw where people are saying, well, private schools, because they're smaller, they don't have to think statewide, are making some decisions about going back. How are they going to do their transportation? The public schools do all the transportation for the private schools. So that is a pretty big piece of how you're going to, unless every parent's going to drive and pick up their kids every day, which we know is not the case. So, I mean, the complicated part of this, I want to get them in there. Here's what I think, and I would tell Minnesotans this. If we could get 90 to 95% mask compliance over the next 4 to 5 weeks, we think the statistical numbers make it so that we can maintain and continue to open. And I tell people that who are saying, well, we need to open the economy. You can wake up in the morning in your house, go for a walk. You can go down to your local coffee shop and have coffee. You can take your kids to daycare. You can go to your jobs in 94% of workplaces. You can go and have lunch on a patio, and you can even go inside and have lunch. After work, you could go and play a round of golf and then go later and watch your kids play Little League Baseball. If we wear masks and social distance, we can do all of those things in addition to getting kids back in school. Yep.
You're good. We just signed your press and we're done.
Very quickly, Governor, if we can't do a bonding bill in August, when can we do it?
Well, that's a good question because I know that, and I think many of you know this, perhaps, you know, after I think there's a nervousness now. There's primary elections August 11th, and then there's the general election in November. I think most of us know how this works is there's an aversion to doing anything the closer you get to an election. So I think it becomes very difficult. I think as Commissioner Franz said, if we didn't get it done now, it was probably going to be very difficult to get it before the election. So, and we'll look at it. I don't say that definitively, but I do say it somewhat dejectedly because we were very clear about this. This thing was done. It was a good compromise. I can't state enough again the good faith negotiations that went on in this. I'm a little, you know, I could be a little miffed on this. I started out at 2.6, they started at 900, and we ended with 1.3. So I think they got a pretty good deal, but I always make the case on this. These aren't my projects, these are Minnesota's projects. And if I can get some of them, I'll take it. I'll take what's out there. And so unfortunately, we may have to wait. And that is too bad because that is a really big job. There was, I believe in this, several $100 million of highway infrastructure bonds. It was almost 400 million in transportation money that we need right now that could have got in, and we lost that, plus 100 million, the lieutenant governor's work on 100 million around housing infrastructure bonds as a minimum. So it's unfortunate. You got them? All right. Thanks, everybody. Thank you all for being here. And thanks for the work. Thanks, Peggy.